when a caregiver is feeling depression, anxiety, guilt, stress, all of these things, there's a lot of different levels of support they might seek out. You know, the most basic of which is taking little breaks. And when I say little breaks, I mean little breaks. Take 5 minutes. You know, go outside, get a breath of fresh air. Go, you know, read one chapter of a book that you've been interested in. Simply go into another room for a few minutes to deal with whatever you're dealing with, whether that's to just take a deep breath, or maybe it's to cry, or maybe it's to tend to somebody else, tend to a child, tend to another family member. So taking little breaks is really important. There can be this sense that I can't let this person out of my sight, I can't turn my back for one moment, or they might be suffering in some way. And the reality is, most of the time they can take the 5 minutes, that they can manage those 5-10 minutes for you to get a bit of a break. It's so important to keep engaged in other relationships. That would be existing friendships, other family relationships that you have. It can be very easy to let those go. And in fact, they're one of the first things that can often go because you feel that there's no other time. You know, you already didn't have time in your life, and now, you know, there's no other time but caregiving. And so friendships can go. Most caregivers that are fortunate enough to have good relationships have the experience of people asking, what can I do? I want to help. What can I do to help? And very often the caregiver says, oh, no, nothing. We're fine, we're fine, we're fine. And really, that's not even true. You're not fine. You really could use some help. So what kind of help could you use? So maybe taking a couple of minutes to really think through explicit tasks that other people could do, whether that's food related or grocery shopping, or coming over for half an hour so that you can get that break if a person needs round the clock care. So taking the steps to remain engaged in those relationships, both for the tangible help as well as the emotional support.